let's look at nervous system anatomy, the main contents of the nervous system. So you need to know that for the nervous system, it's mainly made up of, we talk of the two things. Let me try just to enlarge my screen just a little bit. So the nervous system itself is always made up of two things. So we talk of central nervous system and peripheral nervous system. Now for peripheral nervous system, is further broken down into autonomic and the somatic nervous system. And for the autonomic nervous system, we talk of sympathetic nervous system, which is also in the autonomic nervous system is also further broken down into parasympathetic nervous system. So if you're told about the parasympathetic nervous system, so it's a subcategory of autonomic nervous system into the peripheral nervous system, and the broader thing is always the nervous system. So that diagram just illustrates how the nervous system is now made up of its content. So let's now have just a look at some of the terms and also the functions. Now for the central nervous system, a subgroup of nervous system with central and the peripheral nervous system. Now for the central nervous system, it controls main functions of the mind and the body. Don't forget about that. So it also controls the spine and the brain, the spinal cord and the brain. What about peripheral nervous system? Peripheral nervous system, it contains nerves coming from the brain, spinal cord, to all network body parts. So from the brain, from the spinal cord, that's when we find peripheral nervous system. But for the central, it mainly contains. So when you talk about the spinal cord and the brain, that is central nervous system. But any other nerves that comes from this central nervous system, that becomes peripheral nervous system. So it has somatic nervous system and the autonomic nervous system, the way you've just looked from the diagram above. So for somatic nervous system, it contains sensory. For the sensory, we term it as afferent and motor, which are efferent nerves. And for the afferent and the efferent nerves, their function is mainly to perform reflex actions. That's about somatic nervous system. What about autonomic? Autonomic is part of peripheral nervous system that mainly controls issues with involuntary physical actions. So something about sympathetic nervous system, you need to know it's always in charge of flight and fight response. So we talk of things like stress. In case of stress, sympathetic nervous system, it kicks in. Then it's how does it function? It speeds up the vital organs. So we are having high heart rate, high blood pressure. And why are we having all this? So as in order to fight or even flight in the survival mode. So in case of issues like we've talked of flight and fight response, so we're having stress in the nervous system. So at this point, sympathetic nervous system kicks in, and it aids in speeding up the vitals. So you're having an increase in heart rate and blood pressure, not forgetting heart rate and blood pressure. And this will always aid in flight and fight survival mode. So sympathetic nervous system controls all the catecholamines that is made in the adrenal. So we talk of epinephrine and non-epinephrine, and this helps to constrict the blood vessels so as to speed up the vitals. What about sympathetic nervous system? They're always in charge of rest and digest. So you need just to know about it always puts brakes on the vitals. So if sympathetic nervous system kicking, so we are having low vitals, low heart rate, low blood pressure. Okay. So it mainly works by controlling cholinergic effects, making more secretions in the body. Okay, so that is the first part of nervous system, where we've just looked at just an introduction on autonomics and the somatic. So the next time we'll be looking at what's the anatomy of the neuron and also the type of cells that we find it there. So if you're new to the channel, we kindly urge you to subscribe, give us a subscription, like and share with these other people. Also give us a comment, then we'll be back. This is just part 1. We are coming for part 2. Thank you.